Yeah, it feels more, like we're in real life. All right. Okay, without further ado then. Okay, let's continue. So we kick off our distinguished keynote address with a journey deep into the frontier of neuroscience. Can everyone see my screen? Oh, okay, wait, sorry. Hold on. All right. So our first keynote speaker is a distinguished functional consultant neurosurgeon at Cardiff and Vale University Health Board, whose groundbreaking work spans functional neurosurgery, epilepsy surgery, complex spine surgery, neuromodulation, and emerging gene therapies for neurodegenerative disorders. Holding an MBBS honors, MSc distinction from Imperial College London, FRCS England, and many more such fellowships at Montreal Neurological Institute and other credentials. He has contributed over 30 scientific publications to the medical community. It is my absolute honor to welcome to the virtual stage, speaking on mapping the unseen, deep brain stimulation, and neural circuitry modulation, our esteemed neurosurgeon, Dr. Amad Khan.
Thank you very much for that great introduction, Zara. Very pleased to be here. And, I think this is an amazing initiative. I think you guys are the future of neuroscience and neurosurgery. And I'm so pleased to see all of you here. Now, I want to start off with a story because I think storytelling is the most powerful tool. You've never heard of some random caveman in a cave in the middle of nowhere, but who have you heard of? You've heard of Babylon, ancient Egypt, Mesopotamia, Mohenjo-daro, Harappa, ancient civilizations. Why? Through storytelling. So storytelling is how things survive, how culture, science survives, and how it thrives. The year is 1873. Imagine America just being built, the railways just being built, the Industrial Revolution. The steam engine is introduced. The coal miners see a problem. What will happen? These machines will take our job. There's a revolution. How do we stop it? A hero amongst them emerges. His name was John Henry, a beast of a man, 6'5", strong as an ox. He was the leader of the steel mill workers and the railway workers, rather, of the Chesapeake and Ohio Railway. He says to the supervisors that this new steam engine that has come and is chipping away, and it's a new machine, it can mine much faster, it'll build the railway much faster than us, will make us lose all our jobs. I'm going to stick up for my men. So what he does is he challenges the boss of the railway company to say, first thing at dawn, I'm going to see who can dig deeper, me or the machine. If I win, if I beat the machine and can dig deeper, then you should not introduce it. We all keep our jobs. However, if the machine wins, then, we'll all resign. We're all penniless now. It's fine. We accept our fate. The morning arrives, dawn. John Henry has a heavy breakfast, chips away, chips away, chips away. He beats the machine, gets 14 feet versus the 9 feet when the steam engine goes poof. It just, can't deal with the heat. The man beats the machine. Everyone is amazed. The technological progress has been stopped. He's a hero, a folk hero, as it were. Unfortunately, he collapses at the end and dies of exhaustion. The moral of the story is that even if your intentions are great, even if you try fighting progress, it never works. You may win the battle, but you can never win the war. And such is what's happening in neurosurgery as well. With all these innovations, deep brain stimulation, focused ultrasound, all these different techniques that are coming in, there's a wave of progress. Artificial intelligence is the new one, as you know. People are afraid. We'll all lose our jobs. How will the surgeons operate anymore if the robots take over? These are the kind of things that we should be talking about, thinking about from this age, because I think for you as students in the future of neuroscience, you need to start getting involved in health tech, involved in not only the surgical and medical aspects, but in the technological aspects of medicine, because it really is the future. And if you don't adapt, then unfortunately, you will be like the dinosaurs and be extinct. On that very positive note, let's start with Zara. We'll do a better deal for you rather than just talk about deep brain stimulation in the journey. Let's talk about deep brain stimulation and a little bit more. And I'll make it quick and stick to time. So I'm going to share my screen. And that should be there. Zara, if you could give me a thumbs up that you can see.
Yes, we can see.
Okay, brilliant. So the latest innovations of neurosurgery. So we should be talking about it. We should be thinking about it. You guys will do all the textbook reading. You'll know where the locus coeruleus is and the nucleus tractus solitarius is by tomorrow, right? You'll look it up, you'll learn it. But these are the things that you should be thinking about. Now, neurosurgery is massively evolving. There's integration of all these cutting edge technologies that you may have seen online or seen in hospitals on attachment, or some of you may be working in the field as well and know more about it. Now, the key themes I want to touch on are minimally invasive techniques, advanced imaging and navigation, robots and artificial intelligence, my favorite topic. And then finally, personalized medicine. I mean, that really is the future, right? If you can tailor each therapy to every patient, imagine that, individualized, personalized medicine is the future. So, the first thing that we need to talk about now is MR-guided focused ultrasound, MAGFUS for short. Now, focused ultrasound, the way to think about it is a bit like if you have the sun rays being concentrated through a magnifying glass, and without making any incision, no cuts in the head, you can actually burn a hole in different areas in the brain. And that can then lead to treating of tremor. So essential tremor and Parkinson's are the two main conditions that I treat with this. And it's a bit like magic. I mean, if you see what I'll show you now, a quick video, you'll see, it's like instantaneous results. It's so rewarding to see the patients get better straight away.
Neuroscience. We can actually perform brain surgery on patients. It's not magic, it's neuroscience. We can actually perform brain surgery on patients using sound waves. This means no more cutting through the skin, no more drilling through the bone. Sounds too good to be true? Follow me in the day in the life of a neurosurgeon focused ultrasound edition. This is the frame that I put on the patient's head so that when targeting a region in the brain called the thalamus, it's done with pinpoint accuracy. Today we treat.
So essential tremor and Parkinson's, those are two. There's other things like tumors as well.
The frame
all
on the
experimental.
patient, I take the and with me and the transport team to the second site. Here we have a special MRI scanner attached to the focused ultrasound machine. This MRI scan lets us look at the brain in great detail and helps.
So I think you guys get the sort of gist of it, and I'm sure you can watch this later on. But I just wanted to show you a bit of oh, and while you're here, you can see this is something I'll talk about later as well. Augmented reality. It's like Minority Report, the film. But let's stick to time. So MR guided focused ultrasound. Hopefully, you've got a bit of an idea. Look it up afterwards. It's amazing. In most patients prefer this over deep brain stimulation. In my practice, I would say it's about 80-20. So very interesting and very topical. Then laser interstitial thermal therapy, or LIT. I'm sure a lot of you are Gen Z or Gen Alpha even. So this is that kind of lit. It's, on fire. It's great. It's the new latest thing. We use it I personally don't use it in my day-to-day practice, but I've, been to courses and learned how to do it. Just because my hospital doesn't have a machine. So, all these kits are expensive and, you have to think about the economics and whether it's worth it in your population as well. So I don't have access day-to-day to it, but I think it's an amazing technology. And in simple terms, it's just a laser that can burn away tumors, that can burn away abnormal areas in the brain for epilepsy. Now, adaptive deep brain stimulation, this is very interesting. Now, deep brain stimulation, I'm sure you guys have heard of. It's where we put these electrodes deep in the brain and you stimulate with electrical current. It's something called neuromodulation, and the tremor goes away. The patients can walk again. Their stiffness goes away in Parkinson's. If you have dystonia, abnormal tone, it eases up. So it really is, like a magic. When you turn on the battery, the symptoms go away. The new thing in this is we're using artificial intelligence and called adaptive deep brain stimulation. So you get the data from the brain recordings and you only fire the electrode, only fires when you need it. So you don't have too much movement with the deep brain stimulation. So it's like personalized medicine. Very, very cool stuff. Robot assisted neurosurgery. So this is my day-to-day. I use the robot for essentially making it quicker to put electrodes in the brain for something called stereo EEG, where I put electrodes in the brain to record and see where the epilepsy is coming from, where the abnormal electrical activity is, so that it can be removed surgically. So augmented reality, I showed you that clip already. You saw how it's the future. So for me personally, when I look at that, it helps me see where the tumor is. I can see the MRI and CT scan either under the microscope when I'm operating or just in front of me with the goggles. It's amazing. I don't have to keep looking at a screen. It's in my field of vision. And, even the smallest tumors, the ones which are invisible normally, you can see the low grades. It's really the future. And it was developed by one of my good friends, actually, Osama Chaudhry. This is another thing that I actually do as well. So this is endoscopic spine surgery, minimally invasive. So keyhole, you must have heard of laparoscopic or keyhole surgery for the abdomen and bowel. Same thing, just like gynae, just like general surgery. We're using keyhole, so we're using a camera. So very tiny cut, only 5 millimeters. And you can go in and you can remove a disc. You can even do fusions now. So spine surgery, gone are the days where you would do a massive cut down the whole back. Now just, a few millimeters. Quicker recovery time and all of that. Now, brain-computer interfaces, this is something, again, that I'm involved with. Neuralink is the clinical trial. You must have seen it, Elon Musk company, where you put a chip in the hand knob area of the brain. So it controls the motor, the movement. So if someone has paralysis, so they have ALS, they have a stroke, they have paralysis, they can't move their limbs. With this chip, it can embed into the brain. So 10 to 24 microelectrodes, finer than a strand of hair. You were talking about micrometers. They go into the brain. The connections are formed, synapses, back and forth. The brain turns itself into a sort of cyborg. It makes the connections itself. We don't have to tell it. And back and forth, the connections means that you can control with the brain anything. A computer, you can play a computer game, you can control an exoskeleton, and then you can have access to the whole internet. Think about it. This is amazing technology, right? The potential right now is only for, or the license is only for, paralyzed patients. But in the future, people will use it and may already be using it. Who knows in government or Department of Defense settings to see how, they can make better soldiers, better, military personnel with a chip in their brain. It's no longer the future. We used to say this is sci-fi, this is Star Trek, this is Star Wars. It's here already. So, exciting times. And artificial intelligence is the last one. How am I doing for time, Zara? I don't want to go too over. I think I have what?
No, not at all, doctor. You're perfectly on schedule.
Okay, good. So I think I've got another 4 minutes. It's just I know there's other speakers, so we don't want to keep them waiting. Artificial intelligence in neurosurgery. Now, I think this is very interesting because for me, for the planning for stereo EEG, where I put the electrodes in the brain, would take about 3 or 4 hours before. Now, with artificial intelligence, it takes 5 seconds, done. I have to obviously go over it, and it takes me another 30 minutes, check, double check. But imagine how much time is saved. I can do 2 surgeries instead of one now because of artificial intelligence. Same with the planning for the sprues in the spine. The sky's the limit. I've built an app now with the NHS for using artificial intelligence to augment the role of doctors, make it easier for them to see patients. So if you're not interested in AI, I think you're going to really lag behind. It's quite obvious. Anyone in any specialty, any field should know about AI. You can be an eco warrior and protest and say, let's not drain the Sahara and, the planet will come to an end and data centers. Of course, all of that is there. There are negative aspects to everything, but whether we like it or not, it's going to happen and is happening. So we should be a part of the revolution rather than, look from far away and, when we're basically, way behind everyone else in every aspect of life, then want to be late to the party, right? We want to be early adopters. So artificial intelligence, you can't escape it. Then, this one is an interesting one. So CAR T cell therapy is the personalized medicine I was talking about. Now, with CAR T cell therapy, what happens is it's like a sniffer dog. You train your immune cells, so your white blood cells, these T cells, with cancer. So you get the DNA from the cancer and you show it and integrate it into the CAR T cells. They then produce millions of CAR T cells, which are like a sniffer dog, which then go attach to the cancer. So you can train your immune system to sniff out and kill the cancer cells. And these aren't colleagues, but there's a legend. I spoke to this lady, Professor Long. I haven't spoken to Prof. Scollier, but hopefully I will one day. They were basically very intelligent people who were oncologists themselves and scientists and had the Melanoma Institute in Australia. I want to say Sydney. I think it's Sydney. And they essentially developed this CAR T therapy, this designer, immune cell therapy to kill melanoma, skin cancer, because Australia has a lot of skin cancer. And what they realized, unfortunately, Prof. Scollier himself developed brain cancer. As you can see in there, this is the post-operative scan. And he had his tumor removed, but then he needed some extra, he needed something to improve the outcomes because right now with brain cancer, the average survival is only a year and a half with the best surgery, with the best chemotherapy, best radiotherapy. It's a terrible disease. So then he said, why not use this CAR T cell therapy for brain cancer, for GBM, glioblastoma? And currently, he tested himself. Rather than do a trial on anyone else, he got ethical approval by hook or crook. He said, I'm going to do it. He fought for it and he did it. And still up until now, it's been, I think, 18 months now, he's still cancer-free. So inshallah, we'll see, he'll remain that way, but it's amazing, innovation, people leading from the front, scientists testing things on themselves. And, you have to push the boundaries sometimes to really get the diagnosis, to get the cure. You can't be timid. You have to be bold. You have to think outside the box. You have to work together and, build something. You've got to have that passion and fire in your belly. And, he has it. So he's a top lad. And I think it's amazing what he's done. In conclusion, neurosurgery is being transformed by all these advanced technologies. Innovations are making surgeries safer, better, more efficient. The future is everything I discussed with you: artificial intelligence, BCIs, spinal cord stimulation, deep brain stimulation. If you want to name it one thing, neuromodulation is the future. How we can modulate the brain using electrical current or even magnetism, but Faraday's law, electromagnetism are one. So anything that can modulate the central nervous system, your brain and spinal cord through electricity, that's the future. That's what you should be thinking about, and that's what you should be looking to get into. Thank you very much. I think that's just on time. Do we do questions now, Zara, or
we will actually
because
be
I have
having the
to
panel.
shoot now. You can't see where I am right now because of the background,
Take a few.
but it's a very nice place actually. I'm backstage in a very fancy concert hall in central London, so I need to speak, and then I need to go to another event just nearby as well. So I might need to shoot off now, if that's okay.
Okay,
Sure.
no worries.
If you could do questions now, I'm happy to
Perhaps
take a
there's
few quickly. If not, then I might need to.
Yeah. Is there any question in the chat box?
Or did you want to do those some of those questions that we discussed before, or is that for a later format? So I don't want to ruin the flow.
Yeah, that's for the panel. Yes, that's for the panel. Is there any questions in the chat box? Probably. Zara, can you have a look at it?
Yes, I'm just checking now. Oh wow.
Yeah, I think there is.
Oh, I think yeah. I think some people are sending in.
Question, please.
to us.
Or shall I?
Yeah, go ahead.
I don't know which one to take.
We are still gobsmacked. Great
Zara
presentation. Okay, we can do the. Sorry, I'm a little bit.
I think
I'm
it's about
a little
the
bit rushed.
craniotomy. I think it's about the awake craniotomy. I think there's a student who's asking, how does an awake craniotomy happen, and is that exciting?
How does awake
Well,
craniotomy? I mean, to be fair, I'll be honest. I'm not the expert at awake craniotomy. I do awake craniotomies, but it's really the anesthetist, the anesthesiologist, whose magic is in awake craniotomy, because they give a medication. I don't want to speak for an anesthesiologist, but they have different combinations. The one that I prefer, that my team prefers, is Precedex, dexmedetomidine. So it's a type of, it's a medication that makes you drowsy, but then it can reverse very quickly when you stop. And it's very good for sedation when you do awake craniotomy. It calms, the patient, and they wake up very quickly. We do wherever testing. So, for example, if I'm doing deep brain stimulation for tremor, or I'm doing the MR guided focused ultrasound, which I showed you, where we shine the sound waves into the brain, they're awake. So then you do this. So the patient is awake, you numb the whole scalp with local anesthetic, and then you make a cut, you drill open the skull, which is called craniotomy, and then yes, you wherever it is you need to do, whether it's insert an electrode or remove a tumor in an eloquent area of the brain, you do it, and that's basically it. And the anesthetist is the main one over there because they have to turn on and off the sedation. Then we turn on the sedation at the end to close because the patient doesn't need to be awake. They don't need to be doing any tests of speech or movement of hands or anything when they're awake. Sorry, when they're asleep. They only have to do it when they're awake.
right, amazing. Right, amazing. Thank you.
Thank you so
Thank you
much
for
for
that.
those insights. Should we perhaps take one? Do we have time for one more from the panel? Do you think, Dr. Zarina? Could you just check?
I think we had a hand up, but I can't see it anymore. So I think we can take lead.
Yeah,
and
we can take
carry
one
on,
from the
yes.
panel. Questions that we discuss. So, Dr. Khan, in one of your posts from your Instagram, you had mentioned that the future of neuroscience seems to be moving away from drugs, systemic drugs, and towards smarter modulation of the brain's own electrical language, neuromodulation. Which neurological condition do you think is most likely to be completely transformed by this electrical frontier in the next decade?
That's a very good question. I think Alzheimer's. So there's a lot of work on Alzheimer's, Parkinson's, I'd love to say as well, but all of the research, you always follow the money, right? If you follow the money, so dementia, Parkinson's is Alzheimer's is where it's going. And the reason in neuromodulation is there's a new therapy called TPS, transcranial pulse stimulation. If you haven't heard of it, look it up afterwards. It's very cool. There's a machine by Stores Medical. And it essentially uses the same, ultrasound waves, sound waves like I use for focused ultrasound, but at a slight less intensity. So what that means is then you don't cause any damage, permanent damage, you don't burn a hole, but you can, in theory, get rid of these beta amyloid plaques. You can open up the blood-brain barrier with the focused ultrasound that I'm doing, and that can then give immune therapy, which could potentially clear, the Alzheimer's, the plaques. Gene therapy is another one which massively working on. I personally do clinical trials for gene therapy, but not for Alzheimer's. It's for Parkinson's, frontotemporal dementia, and it was Huntington's, a unicure, but that's finished. And that is the future. When you do this gene therapy, if you can insert in the brain, if there's a faulty gene, you can replace the neurons with the normal, copy of the DNA, you can cure the condition. And this is what I'm seeing in all of these conditions I mentioned. You'll see the trial results will be published. One has already been published for unicure. There'll be more for, the Parkinson's and FTD and things in the future. So, but if you picked one disease, Alzheimer's, because of all the research and all the new therapies that are going into it, I would say, from neuromodulation.
Okay, thank you so much, Doctor, for those insights. So will we see you at the panel, or would you have to?
No, I might have to excuse myself if that's okay.
Oh, okay. No worries. Don't worry
Right?
about that at all. Thank you so much for setting an extraordinary technical standard for these and the conference as a whole. Thank you.
And good luck with everything. I think it's a great initiative, and do keep in touch and tell any of the attendees and things. Feel free to reach out to me on Instagram.
Okay.
You can share
That
it over
sounds
here, my
amazing. Yeah.
handle, or it's the Brain Doc official. And yeah, I look forward to speaking to more of you, in the future. Thank you
Okay,
very much.
perfect. I
Bye-bye.
think everyone heard that. So just get in